Hi everybody! We've just learned about drug classification. There's therapeutic classification and pharmacological classification. Now we need to learn the names of drugs. And I'm telling you, there are literally thousands of them. And to make matters worse, some drugs have multiple names. There are basically three types of drug names. There's chemical, generic, and trade name. A chemical name is a scientific name assigned to a drug based on standard nomenclature. It's assigned by the International Union of Pure and Applied Chemistry. It's based on the drug's molecular structure. Chemical names can be really hard to remember and they're usually really long. Take Valium, for example. Wouldn't want to be memorizing that for a test. There are some chemical names that might be easier to remember, such as sodium chloride or calcium gluconate. But overall, what you need to know is that every single drug out there has one chemical name. Drugs are also given a generic name, also known as the non-proprietor name. You see, before World War II, drugs were predominantly extracted from natural products, but after the war, synthetic drugs became more common. Their chemical names were far too complex and incomprehensible for general populations. So for the sake of safety and feasibility, it became absolutely necessary to have a better system of identifying the physical and chemical properties of drugs. Generic names are assigned by an international generic nomenclature system, which is overseen by the World Health Organization, or WHO, called the International Non-Proprietor Names, or INN. In essence, the originator of the proposed name would submit a request to the INN. There, a group of experts would agree upon a name and then publish their proposal. After 4 months, if there are no objections to that name, it is published a second time as the recommended generic name. The generic name is unique, is globally recognized, and is public property. It is also easier to remember than the chemical name, thus reducing confusion as well as improving safety for patient care. The generic name is the one most used by healthcare providers and the one that you as nurses are urged to memorize. Finally, drugs are assigned a trade name. It's also known as a proprietor name or brand name. It basically means that there's ownership of the drug's name. Someone has registered a trademark and has ownership of the name, and it can't be used without permission. These trade names are usually snappy, really easy to remember, unlike the chemical names. When you are in the grocery store or a pharmacy, you will see a drug identified by its trade name, which is usually capitalized followed by the generic name, often in smaller print written in lowercase. For example, one of the trade names for acetaminophen is Tylenol. In Canada, drug developers are given exclusive rights across Canada for 20 years. That means that competing companies have to wait 20 years before they can sell the generic equivalent of that drug. As a nurse, you might get asked at some point if the generic equivalent of a drug is the exact same as the brand name. The answer is unclear. It's really dependent on how the drug is made, whether they're different ingredients or methods of preparation. Some brand name companies will lobby aggressively for exclusive use of their drug with claims that there is a significant difference between brand and generic equivalents, and that switching to a generic form can even harm patients. The only true way of comparing the two is to study the bioavailability of the drug, which we will learn more about in a later chapter. Essentially, bioavailability is the amount of drug that is absorbed and available to target cells, producing its desired outcome. A crude way to determine the bioavailability of a drug is by measuring the peak drug concentration in blood tests. Some drugs can produce their desired effects sooner than others. A difference of 5 minutes might not be a big deal for medications for arthritis, but in an emergency situation such as a patient in cardiogenic shock, a difference of 5 minutes can mean life or death. International students have an exceptional challenge learning drug names, since trade names will often differ from country to country. It is beneficial to learn the trade names of commonly used drugs, however, good working knowledge of the generic names will enhance safe administration. For example, acetaminophen or paracetamol is known as the popular brand name Crocin, the miracle drug in India, or Biogesic in the Philippines. Here in Canada, the equivalent is Tylenol. So in summary, we've learned the three basic name types for drugs. There's chemical, generic, and trade name. Know the difference between all three of them. Join me in the next video when we look at drug scheduling. Alright, see you later.